Cellulite and fascia blasters. Let's talk about it. So today's format is filmed a little bit differently. I'm at home because I have access to my wonderful PC that allows me to show you what I'm looking at. So this was some of the research I did. It may look like a lot, but I'm just going to break this down step by step. So first thing we're going to do is define cellulite. What is cellulite? So this is from the Mayo Clinic. We're going to click over to that, and you can see here on their website overview, cellulite is a very common, harmless skin condition that causes lumpy dimpled flesh on the thighs, hips, buttocks, and abdomen. The condition is most prevalent in women. Many people try with variable success to improve the appearance, etc., etc. And then it goes on for symptoms, when to see a doctor. Little is known about what causes cellulite. It involves fibrous connective cords that tether skin to the underlying muscle with the fat laying between. And we're going to look at another picture because they say it's more prevalent in women, and there's a reason for that. I'm surprised that they don't seem to talk about why it's more prevalent in women, but here we can see a picture where they show what those fibrous cords look like. So that's the surface of the skin. You can see that dimpling there. And then here's that adipose tissue sitting on top of the muscle layer there. They don't show a comparison between someone who's not appearing with cellulite versus someone who is appearing with cellulite, or presenting, I guess is the technical term. But this is why I have another thing for you to look at. So that's their definition of cellulite from the Mayo Clinic. Now here's the term that we're looking for, fibrous septae. So let's see here. That's getting into this doctor, Anna Avaliani, because I remembered learning about this from some other resource, from like a textbook, learning to use a machine called the endermology machine. That's a whole nother thing. But I remember it discussing that there's a difference between how the fibrous septae is different in men versus women. So here we have the schema representing the gender difference. This is a diagram. This is from ResearchGate, so you can download or view the publication that's talking about this. But this is essentially a more detailed picture. So it has more of the scientific terminology if you want to get really specific. But here we can see how the connective tissue is more parallel versus here it's like a net. So radially running septa anchor or arch-like into corium, forming large standing fat cell chambers with protruding papillae adiposae, women's skin. So this is what those fibrous septae, those connective fibers going from the skin to the deeper layers, that's what it looks like in women. That's how it's laid out. However, in men, we get this crisscross net type shape, network of crisscrossing septa, tangentially spreading out into corium, forming small polygonal fat cell chambers. So because of the way that the connective tissue is laid out, cellulite is going to be less apparent in men than in women, which is why it's more noticeable in women. However, I've also heard, though I didn't find anything to verify this, but I've heard that this layering of the connective tissue, or the way that it's formed, is also partly the reason that women are softer to the touch than men are. I don't know if you've ever noticed that men tend to feel different upon palpation than women, just in general, but men tend to feel more, I guess, leathery, if that makes any sense. That's just my personal opinion from my 7 years of experience in the field. But not everyone's created equal, of course. I've also put my hands on plenty of very doughy men that felt very soft. So it's not a rule, but it's a tendency. So that's that diagram there. And then this is an actual doctor, physician, that explains with this video. Now this is a specific treatment, so this is explaining how this injection treatment works to help fight cellulite. I don't know how I feel about it, but this is just this is a doctor talking about these connective tissues. So I wanted to find as much supporting evidence for that difference in connective tissue, what creates the appearance of cellulite and why it tends to affect women more than men. So here's another picture. I guess it's from a slideshow. Unfortunately, I can't get too much closer into that unless I use my zoom function here. There we go. I like that. So once again, we see that crisscross pattern in men versus the more parallel structure in females. So that's that. So anyway, no affiliation with that doctor or her services or her practice, but that's what that is. And then here's another link that's, you know, who she is, where she got her her background, her education. That's the word I was looking for. So yeah, she's a member of American Academy in Cosmetic Surgery and a diplomate of American Board of Medical Specialties. Now the reason I dug up all this stuff is because it's not so easy to find those diagrams that show the difference between men and women in that fibrous septae, that netting versus the parallel, which I found kind of odd. It was really hard it took a lot of digging to find those diagrams. I don't know if maybe they're more readily available elsewhere, but that's why I wanted to find additional supporting info, that I wasn't just misremembering some odd detail. So now let's talk about the fascia blaster. Now that we've defined cellulite and what cellulite is, it's connective tissue that will get stretched out. Now it can be an accumulation of fat, where as someone gains more weight, the fat cells are then pushing up against the skin, and then those fibrous threads are trying to keep the skin anchored in certain points, so it just makes those anchors more visible. So it can be from someone gaining weight, it can be someone who starts to get a lot of lymphatic congestion, maybe in a condition like lymphedema or lipedema. So there can be a lot of different reasons why that fibrous connective tissue will fall under stress and create that dimpling appearance. So now we're going to talk about the fascia blaster. So first, let's talk about Ashley Black. Who is this person? They are the ones that developed the fascia blaster. So just like I looked into the credentials of that doctor from that other website, I looked into Ashley Black and who she is, and she is primarily an author. So let me show you what I mean. If I go to Google here and I just type in Ashley Black, then we see the fascia blaster there and everything, and we can see it. Okay, details, maybe that's where I see it. Nope. I can't remember how I came across it, but she was listed as an author. I apologize if you hear my clock in the background. Yeah, okay, so she's an author, and she's written several books, and we can just view all the books that she's written. So her foundational book was written in 2017. That happens to be about the time that that conference was getting together about fascia and how that connective tissue can start to mat down. I'm not sure exactly how she formulated her opinion that the fascia blaster was going to work. I did read the first few pages of the book, or kind of glanced over it, and it starts off by saying, first of all, I'd like to thank God because, you know, He is the supply and all that kind of thing, and I don't have a problem with that at all. I just think it's a really interesting way to start your book about fascia and the fascia blaster. She goes on to make a lot of claims that, in my opinion, can be dangerous when there's a lot of emotional call to action behind it, like, you know, a lot of women that are lacking their confidence and aren't getting the most out of life, and you might be thinking that, you know, you've tried everything and nothing else is going to work. Well, I'm telling you this is going to work. So it can, in my opinion, the way that the book is written, at least the first few pages that I skimmed, while it's not bad by itself, it can manipulate a vulnerable population that is desperate. And that's personally, that's a yellow to kind of orange flag for me when I see a book that's written that, you know, promises you the moon and how this thing is going to give you your life back and all that. So I find that problematic. She does not initially say that she's not a clinician. She does not have any kind of doctorate. She's not a scientist. She's not a therapist of any type, whether that's a personal trainer or a massage therapist or a PT, like nothing. She is an author. That's it. Now, I say all that, and I can imagine several of you watching this going, oh, hey, I have a fascia blaster. That thing works great. You know what? It did change my life. That's wonderful. I'm just saying that we want people to be transparent about who they are and where their credentials come from, so someone can make an educated guess or an educated opinion, that whole thing about informed consent, right? Before they just really throw everything into it, you know, because it can cost a lot of money, or maybe it costs a lot of time, and potentially, for example, someone who's on blood thinners that just doesn't care and they're just desperate for the results. There is a disclaimer on the website that if you have blood thinners, not to use this device, but I imagine someone that is desperate enough is going to use it anyway and could potentially really injure themselves. So that gives me some hesitancy. I've never met the woman. I'm sure she's really wonderful and it would be a delight to have to lunch. So it's nothing against her herself. I'm just talking about the marketing aspect of this and how this device has been sold to the public. Now, what I find interesting is that she's got a lot of other older books that are about like Australian corporations, legislation, securities and financial services law from 2003. So it's interesting that she's got this history of writing legal law related books. I found that really interesting. So in my opinion, just off of that, that tells me that she's potentially someone who has a lot of intelligence and critical thinking skills. Law and legal stuff and writing books about that, I already feel overwhelmed. So I have a feeling that she's someone that kept up to date on different kinds of medical research. Maybe she saw that documentary about fascia and something clicked and she went, oh my God, I get it. You know, and that's fine. I would just want people to be really forthcoming with that information, that it's just their personal opinion and what they theorize is going to work well. And certainly there's tons of before and after pictures where people have had really dramatic results that have really improved their quality of life, and I think that's awesome. So overall, I'm impressed with the product on that front. So anyway, that's the background on Ashley Black, who she is, what her credentials are. So an author first and foremost that turned into life coaching and, you know, guru type thing. So yeah, here's some of the before and after. So absolutely, there's results here. It's not snake oil. Here's some of that ultrasound imaging that can show you some of the fascial layers. So this here, where there's that really thick white line, that's an example of what could be fascial matting. And then here you can see how reduced that is, where it looks that those hot white spots all through here greatly reduce in the after image, so you can see what the before and after results look like. Now here's my question. Is this actually an imaging from this leg? Or is this a representation of what they're talking about? Now that's a really important question, right? Because at face value, you think that leg was scanned and that's the image from that leg, and then that's the leg rescanned, you know, so much later. But there's no disclaimer on this image. There's nothing to confirm that it was taken from that leg. There's nothing to say this is representation and not from that leg. But here's an example of what we're talking about. I don't know. So that's her. She has a video demonstrating how the fascia blaster works. I'm not going to spend a whole lot of time here, but here's her describing all these fibrous connective tissues and all the different layers like we saw. We skip ahead a little bit. She shows how the dimpling can start with the fascial matting, and then she shows the magical fascia blaster going back and forth, essentially disturbing and causing kind of vibrations in that connective tissue that is going to mobilize or break down that fascial matting. That is what I believe that to be. And now here it's all magically restored, but there can also be a lot of other factors. Like if someone is having the appearance of cellulite because of a lot of excess lymph, or because they're overweight, I don't know how much benefit they're going to have from the fascia blaster until they also take diet and exercise into their acumen. So I see this as a really good addition to an already healthy lifestyle, because you can have cellulite, the appearance of cellulite, on people that are not in the category of obese or overweight, or they don't have any kind of lymphatic congestion at all, super healthy, but they still will have that appearance because of the matting of that connective tissue. So let's see. Yeah, so not a doctor or any form of clinician or scientist, published the first book on fascia in 2017, wrote some kind of law books before, and then this is the scientific article that she quotes specifically. The effects of fascia manipulation with fascia devices on myofascial tissue, subcutaneous fat, and cellulite in adult women. So the purpose of this study was to investigate the effects of mechanical fascia manipulation techniques as a non-invasive method to treat cellulite. Now, who was involved in this? T. Bart Jameson, Ashley, Diana Black, International Holdings, LLC, okay, Ashley Black herself, and then we have the Applied Science and Performance Institute in Tampa, Florida, another person from Tampa, Florida, another one from that same department, and another one from that same department. So they're directly involved with the scientific article that they're quoting. So, but it looks like they brought in some people that may not be involved personally or financially with the product. They don't stand to gain, other than perhaps Ashley Black funding said research, which can be problematic in other ways. But it seems like we can pretty easily, for example, view further author information. So, well, here's T. Bart Jameson. I couldn't actually find the profiles of those other people listed now that I'm remembering, but I did find this person. He has an email listed, so I guess you could reach out if you wanted more information about who was involved in this study. These are the references that they made throughout the article, and so there's a lot of information through here. I don't have a lot of time to do a deep dive, but on the surface it appears that they try to do their due diligence to fund some research to support their claims about the fascia blaster. So that's great. Now, I believe as a massage therapist that this fascia blaster is helping to mobilize that fascia and create really great results in people. However, one of the questions that came to mind is, what about cupping? Could cupping be a similar solution that is going to have less of a chance of bruising? Because the fascia blaster, people can bruise themselves pretty easily depending on a lot of variables. So cupping is something that's potentially less invasive or less aggressive than the fascia blaster. So I'm not totally discounting the fascia blaster, but I also have some other articles here. Effects of cellulite treatment with radio frequency, infrared light, mechanical massage, and suction treating one buttock with the contralateral as control. So I don't have access to the full article, but here's the abstract, which can give you a lot of really great information. It can help you decide if you wanted to get access, which is usually a one-time payment or a subscription to be able to access a database of a lot of scholarly articles. But anyway, background and objectives: a system that combines bipolar radio frequency and intense infrared light together with mechanical massage and suction has recently been reported as being efficient for cellulite treatment. The present split study was designed to evaluate the efficacy of such a system through various treatments, blah, blah, blah. The one thing, then they detail like what the procedure was. So sessions were conducted twice a week for a period of 12 weeks, clinical photography and profilometry were carried out to assess textural changes before and 2 months after the final treatment. Histopathology was performed at baseline, blah, 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 blah. So, okay, here's the results. All patients noted improvement in the treated buttock before the final session, which was maintained at the 2-month assessment. Improved skin appearance was noticed after the first session and was maintained throughout the study. All patients, that's a big deal. Every single one that participated in this were satisfied with the results and requested further treatment in order to balance the results in both buttocks. That's like saying 10 out of 10 dentists agree that you should use our product, okay? Like, to me, that's a big deal. I'm trying to remember, 10 patients. Okay, yeah, so 10 people, all 10 people. Now, I don't know what their, how they sampled. You know, is usually they try to do like a random sampling. Unfortunately, you can't really do like a double-blind study, so that makes these things kind of problematic. Double-blind means that it's usually used and is best effective in like pharmaceutical type of research. So one person gets the actual treatment, a pill that they're actually developing, another person gets a sugar pill that doesn't have anything in it, and then you got the control group that doesn't, you know, get anything, and they know it, I guess. But essentially, the people doling out the medication don't know if it's the actual medication or the sugar pill, and the people receiving the pill don't know whether they're getting the actual medication or the sugar pill, because they're trying to eliminate placebo and nocebo. So could there be some placebo in here? You know, I don't doubt it, you know, but they still got results. They still felt better. So there it is. Now, something else. Carmen Romero, Natalia Caballero, and then Monse Herrero. So these people do not appear to be involved with Ashley Black. So here we have another scientific study that uses a lot more than just the mechanical manipulation, that also gets great results, that does not appear linked to Ashley Black at all. So I would call this like a supporting evidence type of article. And effects of cupping therapy on skin's biomechanical properties in Wistar rats. So this was made by a group of Iranians, if I remember correctly. Mohammed Mohsen Rustai. I'm not going to butcher any more names. I'm not sure how to pronounce all of these. But Physiotherapy Research Center School of maybe that's a typo, rehabilitation, Shahid Beheshti University of Medical Sciences in Tehran, Iran. So you can tell where this came from. Cupping therapy has been widely used. I wanted to find something that was just cupping and not cupping with a bunch of other stuff. Skin stiffness and ultimate tensile strength of all rats were measured. Skin stiffness and ultimate tensile strength were decreased significantly. And so essentially, you can pause this if you want to read through it, but it's saying that they had good results in these rats using the cupping. Like there were measurable results from using the cupping to reduce skin stiffness and ultimate tensile strength. So if it's reducing the skin stiffness, then I imagine that's going to help reduce the appearance of cellulite as well if things are mobilized a bit better. So that's another independent or separate supporting. And then here's something about dynamic versus static application of the cups. I really went above and beyond with this one. I really just did a really deep dive. But this is another. Let's see, Caleb Nicholas, I guess, Mr. Pratt, California State University in Fresno, ProQuest Dissertations Publishing. So I think this was someone's dissertation. So examining the effects of static and dynamic myofascial decompression on strength in healthy college-aged individuals with limited hamstring length, a pilot study. So they define myofascial decompression, the methods, 29 individuals randomly assigned to static or dynamic. Now, static or dynamic cupping, let me take a second here. Static cupping is when you place the cup and you don't move it. You suction it onto the skin and you wait. Dynamic is you've added, you usually would add some kind of lubricant just for static application as well. But for the dynamic, you might need a little bit more of that lubrication because you're going to apply the cup and then you're actually going to move it around while it's suctioned onto the skin. We call that dynamic. So they were comparing the results. Here's their conclusion, or the results. No statistical significant effect on strength found for either application. So people didn't, if they were able to do a hamstring curl with 10 pounds of resistance before the treatment, they were able to maintain that 10-pound hamstring curl afterwards. They didn't lose the strength of the muscle, is what I take that to mean. Both interventions experienced a significant decrease in perceived pain between, during, and after intervention. A dynamic application produced subjectively less ecchymosis than a static application. Ecchymosis, what's that? That is the medical term for bruising. Now, depending on who you ask, people are going to tell you that the cupping marks are not bruises, because bruises are technically caused by a crushing force. But if you've got decompression going on, that's not a crushing force. And it can appear like a bruise, it can have coloring similar to a bruise, but the difference in a cupping mark is that it is not going to be sensitive to the touch, usually. Or if it is sensitive to the touch, it resolves very quickly. So what they're saying here is that if you apply the cup and move it around, you're going to have less appearance of bruising. And they say subjectively less. So they didn't have a definitive way to measure the amount of bruising that is happening in these people. This study helped to identify that dynamic myofascial decompression application is able to be used with minimal production of ecchymosis without a detrimental effect on strength. So you can use dynamic application of cupping to get really great results, less cupping marks. So for people that are really squeamish about the cupping marks, or they just don't believe you when you say that those cupping marks aren't tender, it's a different application that can get great results and be more comfortable for clients. And of course, then there's more details of the study if you really wanted to dive into that. But the reason I pulled this up is because fascia blasting has a higher chance of bruising, in my opinion, according to everything we've read today. Fascia blasting is going to have a higher chance of self-imposed bruising as opposed to dynamic cupping, which is going to be less likely to cause bruising. And I have seen pictures from people misusing fascia blasters and really badly injuring themselves. So overall thoughts. That was a lot of information that we slogged through. I hope that it wasn't too much, but what it all boils down to is I believe that a combination of things is going to be probably the best. If it were me, if I got a fascia blaster. Now, why doesn't foam rolling work as well as fascia blasting would? That's another question that pops up into my mind. I didn't delve into a lot of research on it, but what I'm picturing is that the fascia blaster, depending on how you're using it when you're moving it around, is going to be similar to something like whisking eggs. So imagine if you tried to mix and whisk your eggs with a fork, where it's got several tongs that can grab, lift, separate, and disturb things a lot more than a rolling pin. If you got a rolling pin out and you tried to mix your eggs with that rolling pin, it'll probably get it mixed, it'll certainly break the yolks, but I don't think you're going to get as specific as if you're using something like a whisk. So cupping is less likely to leave bruising, in my opinion, especially if it's used dynamically. So that's my take on the fascia blaster. I think it's potentially a really great product for a lot of people, but there's certain things that you would want to take into consideration before investing into that tool. Do you have a lot of lymphatic congestion? Do you bruise easily? Are you on like prescription blood thinners, or do you take aspirin every day? You might consider a different modality. And once again, with the cupping, if you have circulatory issues, blood thinners or blood pressure issues, cupping is also going to be something contraindicated. But you still have lymphatic drainage, which can be indicated in a lot of those cases and may in fact help, depending on the cause of high blood pressure and all that. You can see how complicated this all gets. There's no one answer, right? There's no one thing that you can go out and buy that's going to have everything you need. Is kind of my ultimate takeaway. So that leaves us with, do your own research, read things carefully, think critically before purchasing something from someone that claims that it's going to change your life. Take a step back and understand more about who it is that's selling it to you and what backs up their claims. So I think she has a lot to back up her claims, in my opinion. The one caveat is desperate people being manipulated by promising the moon. So anyway, that's today's info snack. Might have been a little more than a snack, maybe 2 snacks. But I hope you liked this. And if you haven't already, I always recommend that membership, getting the subscription to the website if you want more technique videos for massage therapists. We have the free monthly Zoom meetings for discussing therapies like craniosacral or business and marketing and things of that nature. And then we have the monthly MMP Zoom meeting, case studies and demonstration of assessment and techniques by TC and or myself, and those are for paid subscribers only. So if you haven't yet, I would consider that, especially mainly if you're a massage therapist. If you enjoyed this video and you think you have friends or family that would find this information valuable, if it helps them make a decision for themselves, then I encourage you to share this, and I will see you next time.